Lots of questions about the cost of dental implants. What affects the cost?
So there are a lot of things that can affect the cost. There's usually 8 of them that can affect the cost. And I have a sheet in front of me, so I don't really leave anything out because I want to make sure I cover it all because it's really important to understanding this procedure and what your options are. So the first thing is usually the number of doctors and locations involved, meaning is one person doing this? Or are you being seen by one person to place the implants, one person to maintain them, one person to put the teeth on, and then you're kind of being shipped around town paying
that
different.
Happens.
It does.
Okay.
So you told me a stat earlier that about 60% of dental offices do it exactly that way. So you're being shipped around from office to office to office, and as a result, the fee is not unanimous. It's not one fee. So that's where you're going to start.
So you have one doctor, one fee at your office.
Exactly.
Okay.
So when you have one location, in-house labs, things that drive down the cost, we pass off that savings to you. So therefore, it lowers the cost. The second thing is usually the type of implant chosen. Now, there's a few things that can factor this in. An implant costs someone like me maybe $150 to $200 given the type and the manufacturer, but there are also special types of implants for patients with minimum bone, or the patients who said they have been told they don't have enough bone. Well, there's certain types of implants for you. Those may run anywhere from $500 to $1,000 and therefore also drive the cost up. So knowing what is going on and knowing the types of implants you need is also part of that cost guide. If you are in one office that streamlines everything in the process, the third thing that usually brings up the cost is a big lab bill. A big lab bill usually happens like we talked about when you're going from office to office to office, or paying someone else to come in and do a procedure, or a lab guy to come in because you don't have a printer or an in-house lab. That drives up the cost.
So you actually make the teeth right there. You print the teeth.
We print out our own teeth. We use our own machinery, and we have our own technology that really cuts this cost and slashes it, which means we can probably be, or not probably, we are very affordable. The fourth thing is usually insurance coverage.
What does insurance cover?
Not a lot, but a lot of people, a lot of our calls come in will say, well, does my Medicaid cover this, or does my PPO, or does my health insurance cover this, my medical insurance? These are a lot of questions, and they may cover it. So a dental insurance typically will give you about $1,500 to $2,000 a year. It can range in that. It can even be lower as $1,000. But that is not enough.
So it doesn't really cover it.
To cover it, no. And Medicaid, Medicare typically doesn't cover these expansive procedures. They typically only cover the basics, the preventatives, cleanings, crowns, fillings, cavities, easy stuff. Now, medical insurance is even more challenging for dentists because we don't work in hospital settings. So that's another question where, unless it's truly a medical necessity, that's something that would have to be done in a hospital setting, which isn't where this is performed anyways. So we offer financing options. We offer.
So a lot of people finance this?
Most of them finance. Most of the
You have to have okay credit?
Yeah, you have to have okay credit, but some of them allow for lower credit as well. So knowing your options.
What about cosigners?
And cosigners are encouraged as well. So knowing those options, and we'll lay those out to you at your consultation visit, are very important. But coming in and getting those options laid out in front of you is probably one of the most important decision-making steps and action-taking steps of this whole procedure. Now, another one is lower cost options. The fifth reason. And now that's going to be snap-in. Think of it like a denture without glue. You put the implants in, and the teeth can still pop in and pop out. Now that is something that will be advertised as low. It's teeth, but it's low priced. But that's also not
So when you see
permanent.
Advertised prices on dental implants, they're really talking about snap-in dentures a lot of the times?
They could be talking about snap-in dentures or just the placing of the implants. So you have to know what that advertisement is telling you.
Is that misleading in your opinion?
It could be a little misleading, but they may also be telling you the truth, but not including every step involved. So coming into the consultation and hearing that, is this all the steps that are involved? If this is one bill, does this include my sedation bill? Things like that help, and we include all of that in one price. So the sixth thing is the material of final teeth. Now,
I mean, what the teeth are made out of.
What the teeth are made out of. And this also affects the price because you may see something like, it's all in and done and everything's good to go for $10,000. Example. But what that might mean is that they're acrylic teeth and they're not strong.
Like denture teeth?
Like denture teeth, exactly, like denture teeth. Now, zirconia teeth are what we would prefer to put in because that's how you chew steaks, bite apples.
Is that the gold standard
in
implant dentistry?
In 2025, today, gold standard. It's what will restore everything the way you want it. Now, the other ones, acrylic, can break. You bite an apple with that, you could break, and you're thinking, what the heck, I got my implant.
So later you end up having to spend more and get it done correctly?
Yes, exactly.
So there's ways to cut corners on this for dentists.
So you want to make sure at your consultation visit you're asking all those questions. Are these zirconia teeth over my implants? Very important, and making sure that's included in your quote. Number 7 is going to be the extent of surgery required. Now, if you are in an office, like our office that does it all in-house under one roof, that is one procedure in one day. Typically, all the teeth will be removed, all the infection, all the gums will be cleaned up. We'll place the implants, and we'll get you your smile in one day. There's no bone grafting or extensive procedures or sinus lifting that can drive the price up by thousands, take years, and you still don't even have an implant in your mouth.
Okay.
So that is another.
So you include that?
We include it all.
Okay.
The price you get is a start to finish price.
Okay.
And we've streamlined the process, so it really is less visits. So it is more of a value.
Okay.
The last one is the surgeon experience. And this is arguably the most important.
Okay.
You know, I've taken it upon myself to learn from some of the best in the world. I've learned in the United States, outside the United States. I've learned from some of the top.
Outside of the United States?
Yes. I've spent time in Brazil. I've spent time.
Is there that much to this?
Yes.
Why would you go to Brazil?
This provider in Brazil is a pioneer. He's engineered ways to perform these procedures on people with virtually no bone at all. And now we bring that back into our practice and we can implement and roll that out. So it's also part of our price. So continuing the theme of gaining experience, investing in the technology, learning from the best, and bringing it all in-house to give you the most affordable solution possible, and also bringing the experience at the same time. It's a 2-for-1. It's the ultimate value.
So when they call you and say how much are dental implants, it's just not that easy.
It's not that easy.
It would be misleading to almost quote them a price. Is that true?
So things you see online are not all they're cracked up to be. It's kind of like when you go buy a car. That price you see doesn't include tax. It doesn't include all the other things. It's just a price. What you need to do is come in for your tailor-made consultation, your tailor-made plan. Get the price that's for you and make sure it's all done under one roof. And Randy, we know what's out there. We know what some of these price points could be when you get referred around, or even what some of the bigger corporations and groups are charging. We are aware of that. And we have engineered our fees to be about 27 to 30% less than the competitors.